Let's talk a little bit about root canals. So there's a lot of kind of chatter in the space now in oral hygiene about how sometimes root canals or most root canals are done improperly. And then again, just like the wisdom teeth, there's like spaces left, dead space, where bacteria can grow. And then that may be the final root cause in terms of why you're not fully healing. Maybe you've worked on the gut microbiome, you've worked on your diet, but you're still not fully healing. And then it may be an area that we can look into. If you can kind of talk a little bit about that for us.
Well, that's true. First of all, a dentist that does a root canal is not purposefully not doing the root canal correctly. Right. The problem is we're dealing with microorganisms and we don't have the technology to deal with such small animals and take care of them effectively. And then again, once that happens, the tooth is a dead tooth. So if it's a dead tooth that had no ability to produce toxic elements, I guess it wouldn't be so bad. But here's what generally happens. When a nerve is infected in the tooth and it has the blood vessels and lymphatic tissues and everything, cellular structures, and it dies, it necroses, it dies, it has toxic elements that are being created, and it's pushed out through the tooth at the bottom of the root called the apex. But there are other what's called accessory canals. If you can imagine the limbs of a tree, lots and lots of thin limbs and thinner limbs. There are thinner and thinner little channels that go from the pulp, the nerve area of the tooth, into the surrounding bone that supports structure, the of the tooth. And those canals become microscopic, but the bacteria are microscopic also. So they live these canals, they push growing canals, they push themselves through the canals into the membrane that supports the tooth root in the bone, and it's toxic in that environment. So the root canal, where the dentist removes the infected tissue and puts a filling material in, is not capable physically, biologically capable to fill these microscopic tubules that go from that major nerve canal into the side of the tooth, where the periodontal ligament is and the bone. So that is an area where bacteria can grow. Frequently, the material that is used for the root canal could be toxic, and it could leak into the area around the bone. And the biggest problem is that you have no swelling and no pain, and you think everything is great. And the dentist doesn't look at it anymore because you're not complaining. And the x-ray may or may not show something, but the dentist may say, well, it's a healing root canal. It's healing. Well, how does he know it's healing? Or how does she know it's healing? What actually is happening is the immune system is being affected, again, 24 hours a day, 7 days a week. There are toxic elements and bacteria, inflammation and infection getting out into this environment. Microscopically, the immune system is fighting to get this infection under control, and it's failing. And this infection and inflammation gets into the bloodstream, gets into the lymph tissues, gets into the nerve canals, and it channels itself throughout the rest of the body, creating a chronic systemic inflammatory result. Basically, allowing other organs based on their genetic predisposition to break down to become infected or inflamed, and then chronic disease becomes prevalent. Our chronic disease in the United States is huge. The CDC says 60% of the US population has at least one chronic disease, and I think they're underestimating it. 70% of all deaths are related to chronic diseases. This is huge. This is a disaster. And all of this could be a contributing factor. That's why SIBO maybe is never treated correctly, no matter what is done, because all this infection is constantly pouring into the body from the mouth, which nobody knows about. And the dentist that could diagnose it maybe don't know anything about the gut and the systemic circulation. And those functional medicine guys and gals that know a lot about the gut and systemic circulation don't know anything about the mouth. So these healthcare professionals have to integrate their awareness and the ability to diagnose and treat it as a whole person, which we are.